Good afternoon. I'm George Latimer, Westchester County Executive. This is Monday, November 8th, and we're happy to report, as we do every Monday at 2 o'clock, to give you an update of what's happening in Westchester County relating to the COVID virus that we're still in the throes of fighting, and also a few other issues that may be of value. I'm joined, as I always am, by Deputy County Executive Ken Jenkins, who will be making part of the presentation today. We have with us here Dr. Sholita Amler, who is our Commissioner of Health, and she'll be joining us to talk a little bit more about where we are heading in the vaccination process of COVID. Some big changes have happened. Some large groups of individuals are going to be able to be vaccinated for the first time, and some of us who've been double vaxxed already get the opportunity to be vaccinated with a booster shot, and so there's some additional things that are happening. First, we want to mention that with COVID, right now in Westchester County, we're in a relatively flat situation over the last 2 to 3 weeks. We are hovering right now at about 1,100 active cases. That is down from our peak in August of 2,800 active cases, which means we're getting a little less than 100 new cases a day. The percentages are very small, but it is a steady infection rate that has not continued to drop over the last couple of weeks. We are in a period of time of transition, leaving the fall season, entering the winter season. More of our activities are going to be indoors, which may open the door for us to have some concerns about greater spread. We also, on the other hand, are entering a period where those who will get booster shots should be more resistant to getting the getting the disease, and young people under the age of 12 are going to be vaccinated. Some have already been vaccinated, as we'll see in a second, and that hopefully will reduce the potential for spread as well. Right now, we have, in addition to a vaccination rate of 91+% in Westchester County, that tracks adults 18 years of age and older who have gotten at least one shot, and now we're looking at a smaller group of people that still await the second shot. All of them pretty much are waiting for the third shot. But 91+% is a tremendous percentage. Under 9% of Westchester adults have yet to be vaccinated. So here in Westchester County, without benefit of any mandates, we've been able to achieve a very high level of vaccination, and therefore we've seen a very low level of spread in general of the disease. We have with us as well the statistical information that we're still very low in terms of hospitalizations, in the 30 range, 30 people in the hospital at this point in time. That's much below peak periods of time. We had about 50 to 100 people earlier in the summer, and then of course in our very peak periods we had as many as 600 people hospitalized, down to about 30 give or take right now. The fatalities have been relatively flat, in the vicinity of 2,350 individuals. And again, every individual fatality is a tragedy, but those numbers have been sort of slow to climb, and we're hopeful that they continue at zero levels on as many nights as is possible. The new movement is in additional vaccinations. You followed the work from the federal government. They have authorized now a booster shot for those who took Moderna or Johnson & Johnson, the Janssen shots earlier in the year. They had already previously approved a booster shot for those who had taken Pfizer. And then, of course, now the authorization of shots for those under the age of 12. I'd like to ask our Commissioner of Public Health, Dr. Sholita Amler, to join me here so she can talk a little bit about the issue that relates to vaccinations for children. Now that it's eligible for those from the ages of 5 to 11, those issues are a little bit different than they play out for adults. Dr. Amler is by profession a pediatrician, in addition to a public health professional, and she can give us a little bit of information of why kids need to be vaccinated, what to expect, and a host of other things that would be helpful. Dr. Amler.
So thank you. And as you just heard the county executive say, on November 2nd, the approval was given for the Pfizer vaccine for children ages 5 to 11 years old. We're very excited about this. We've been waiting for this to happen. And so it's just really wonderful news. And so we have some children here today who just received their vaccine, who are going to share their information with you. I think it's really important for us to remember that children are at least as likely to get COVID as adults. And in fact, children ages 5 to 11 years of age are at risk for serious illness if they get COVID. The multisystem inflammatory syndrome that we have talked about in the past, this syndrome is largely seen in the pediatric population, especially those who are between the ages of 5 to 11 years of age. And so This really just means that now we have the tools to prevent this age group from getting COVID, and hopefully that will reduce the number of children that unfortunately end up hospitalized with this particular syndrome. In the United States, there have been more than 8,300 COVID-related hospitalizations in 5 to 11 years old from March of 2020 to mid-October of 2021. Here in Westchester, our 5 to 11-year-olds account for 9% of all of our COVID positive cases. So 9% of the people who end up with COVID every day are unfortunately children in this age bracket. And so if we just take a look at today, a year ago, so back in November the 8th of 2020, our COVID positive case count for that day was 259 cases. Today, our case count is 80. So we have 2/3 fewer cases today than we had a year ago. And if you remember, right after Halloween last year, we saw the beginning of a significant increase, and we ended up with another wave of COVID. So what's the difference between last year and today? 1 year ago. The difference is we now have the ability to vaccinate most of our population, and we're adding an additional age group to that that's going to be happening in our clinic and at a lot of other locations. So if you have a child that's in this age bracket from 5 to 11, I would really encourage you to reach first out to your pediatrician, see if they're going to be given the vaccine. If they are not, there are a number of pharmacies within the county that will be giving this vaccine in addition to our health department clinics. So what can you expect as a parent if your child takes the vaccine? What are the possible side effects of this vaccine? Well, it's just like any other vaccine. So they could get a little redness or a little pain to the site. They could run a slight fever. But most of those are just like any other childhood vaccine that your children might get. If it's anything more than that, I would suggest you reach out to your pediatrician, but most children are probably not even going to know the next day that they even got a shot. So I think we're going to have, as I said, these young people come up and talk for a second about their experience in getting the shot. But I think the two most important things about this vaccine is, one, for parents, it means that if your child has an exposure to COVID and they are fully vaccinated, and as long as they have no symptoms, they will not be required to quarantine, which means they won't miss 10 days of school, which is huge because we know that children need to be in school if they're going to learn. And so this allows the schools to keep those children in. And secondly, as I think you'll hear from some of these kids, it will prevent them from potentially exposing older family members who might not do as well if they got COVID. So I appreciate it, and we're very excited for this day and so grateful that we now have this opportunity. Thank you.
Thanks very much, Dr. Amler. The County Health Department, under Dr. Amler's direction, is working right now with our various school districts to partner in setting up vaccine clinics for students at their various schools. We do have some school clinics that are coming up this week. We'll mention them in a little bit. And we have more to come, and we're working, as we did this morning in our conferences with school superintendents to try to identify exactly how best to reach those in the age of 5 to 11. It's a little bit different structure than when we did adult vaccination, working out of certain centralized locations such as the county center and our clinics and a few other things. We've asked our school districts to survey their parents to gauge the interest for vaccinations, and we hope that will help us. When the public health clinics through the health department become available for the group, all of this information will be on the health department webpage for Westchester County government, westchestergov.com. You see different departments. You can click on Department of Health. That's their specialized page, and you'll see some of that information there. And then separate from that, we have in the state of New York the COVID-19 page of the State Department of Health webpage. They have a tool that's called the Vaccine Finder. And when you click onto that, you'll be able to locate community vaccine sites in your area. That oftentimes includes pharmacies that have been given an allocation of pediatric vaccinations, as well as those for those of us who are adults. And you can certainly check with your child's doctor and their healthcare providers. So with vaccinations now at hand, I want to ask Dr. Robert Baker, who is, in addition to being a medical doctor, he's chair of the Westchester County Board of Health. He is here today with his wife, Melissa Baker, and their 2 children who are going to come on camera and become famous in a couple of minutes. Aaron Baker, age 10, and Sophie Baker, age 9. I think we're going to go in the order of their age. So in addition to Dr. Baker speaking, we're going to ask Aaron and Sophie, and I'm going to give them a couple of extremely penetrating questions for them to answer. We're also joined here by Ms. Ariel Cherba, and her son, Chael Cherba, is here as well. And Chael will come up and sort of stand there and prove to the world that they were here today instead of playing hooky. So let me ask Dr. Baker to come and share some of his experiences, not only as head of the Board of Health and not only as a medical doctor, but as a dad and having some of his kids vaccinated. Dr. Baker.
Thank you, County Executive Latimer. I'd like to thank the County Executive and Dr. Amler for encouraging my kids to help promote the vaccine for 5 to 11-year-olds and their friend Chael. I think this vaccine is very important for this age group. This will change the direction of the pandemic as it's the last age group of significant spread that we really haven't had some penetration of the vaccine into, and now we're getting it. We discussed it fully with our kids, including potential side effects, and they helped decide that they were in favor of the idea of getting vaccinated against COVID-19, and they'll discuss the reasons why with you. So if you're ready to hear from the stars of the show, I'll invite Aaron and Sophie up. Aaron, Sophie?
Aaron, Sophie, please stand right here.
And I'll let the county executive ask you some questions, okay? I'm gonna
Aaron,
sit
you
down.
get behind the microphone, Sophie right next to him so that you can answer some of these questions.
You wanna get Chael up here?
Chael, why don't you come up just so the world can see that you're here? Very good. We're all here, all hand on deck. First question, very simply, did the shot hurt? Aaron?
No, but it was numb for like a few seconds. I would say that's all.
Okay. Sophie, what about you? Did the shot hurt?
No.
Tell the folks on the microphones they can hear you.
It didn't hurt, but it was a little numb, like Aaron said in the beginning.
So next question, I'll start with you, Sophie, and then we'll go to Aaron. Why did you get the shot?
Because I got it because for my older
Relatives. Right.
relatives, I don't want them to get it, and I've been going to their house a little bit, so I don't want them to get sick.
Very good. Aaron, why did you get the shot?
I noticed that a lot of my friends were getting COVID when I was in 4th grade.
Mm-hmm.
So we once we can go and get it. We did, and then like everybody's like getting the vaccine, and I noticed like a lot less people are getting sick.
So final question for you, and then Chael, I'm going to invite you if you want to say anything. Aaron, would you encourage other kids to get the shot?
Yes. I know how it feels to be on Zoom, like from last year and then a little bit of the year before that. I know none of us want to go through that again. So, like, get the vaccination, if you, like, don't want to go through that again, then, so get the vaccination, and, like, if you don't want any of your relatives to get sick, and...
Mm-hmm. Okay, very good, Aaron. Sophie? Thanks. You want the question? Would you encourage other kids in your age category to get the shot?
Yeah, because it's more safe and you won't have to go through Zoom like Aaron said again, and a lot of people hate it.
Okay,
So.
very good. And Chael, any comments you'd like to make, please feel free.
I'd like to make a comment about the vaccine and why kids should get it. Kids should get it because when, say, someone has to go to a vacation, they have to pay like extra money for like the vaccine. I mean the test to go on the plane, and the COVID shot only feels like a little prick, and like it feels like someone's just poking you for like a millisecond.
Very good. Yes, thank you. We want to thank Chael Cherba and then also Sophie and Aaron Baker for sharing your thoughts with us. You can feel free to sit down, and when you become famous, just remember you launched your career. You launched your career right here in Westchester County government. And we want to thank Dr. Robert Baker and Melissa Baker and also Ariel Sherba for being with us here and allowing your children to come and speak in terms of their interest on this thing. Thank you. Thank you for that. And Dr. Baker, thank you for your leadership. Chairing the Board of Health is not an easy task. It's additional work on top of a busy schedule already, and we appreciate your service to Westchester County. Thanks very much. So with the voice of the young people, we are trying very hard as a county government to make vaccinations available across the board. I mentioned earlier that we have not made any vaccine mandate at any level. We don't have societal authority to do that as a county executive. We would have authority to do it within our workforce, but we found great compliance by making the public education case that it was necessary, and then also by making vaccines easily available all across Westchester County at various times during this pandemic. Dr. Amler and our friends in operations, Joan McDonald, Emily Saltzman, did a yeoman's work in being able to have a variety of places where vaccinations could be authorized. We're going to do that again for the booster shots, and we're also going to do that working with the school districts. We have our two walk-in clinics. The White Plains Clinic is at 134 Court Street in downtown White Plains, just about a block and a half from where we are here. And there's a Yonkers Clinic at 20 South Broadway. The White Plains Clinic is open from 10 a.m. to 1 p.m. every Friday. You can walk in and get a first dose of either Pfizer, Moderna, or Johnson & Johnson. And the same applies in the Yonkers Clinic, open on Thursdays in the afternoon from 4 to 7. First dose of Pfizer, Moderna, or Johnson & Johnson. There's a White Plains booster clinic that has been set up at the location I've just mentioned, 134 Court Street. That's on Wednesdays and Thursdays from 9 a.m. to 1 p.m., and those are the booster shots for Pfizer, Moderna, and Johnson & Johnson. And in those situations, you must have an appointment. So an appointment is necessary for that. We have some upcoming pop-ups or satellite ones for those who are over the age of 12 years of age in Mount Vernon at the Cecil Parker School Auditorium on the 15th of November from 10 a.m. to 2 p.m. It's the first dose for Pfizer that's open to the public. Hamilton School on Oak Street in Mount Vernon in the gymnasium on the 29th of November from 10 to 2, a first dose of Pfizer also open to the public. All of those clinics are just the beginning of our efforts. You'll see many more clinic dates established. You can keep an eye on our westchestergov.com page, and we'll list all of those information that you can see. And then, of course, working through the state vaccine finder, you'll find more than just what the county government is doing, and hopefully you'll be able to find that available to you. Some folks, have relationships in the city, and they can get shots there. By all means, whatever it takes for you to get vaccinated at the most level of protection, we certainly support that, and we think it's a good idea. But the individual has to see that in light of what we've just said, which is we have a diminishing amount of infection rate, and we are one of the highest vaccination rates in the state, and we're very happy to see that, because what we want is people to be healthy. We're not looking to change your life. We are looking for you to live your life and to have as extended a life as possible. Just a couple other topics to mention. First of all, tomorrow, we will have a press availability in which we will release the full 2022 proposed county budget. We've done some previews of it already. We've talked about probably the biggest highlight is the $7 million cut in county property tax levy. That's the deepest cut in 20 years of county property taxes, bar none. Bar any past action. It's the third year in a row that we've cut the taxes. But the budget is more than just what you're cutting in terms of taxes. We want to lay some of that out to you tomorrow, and we want to lay out what the budget does to help you in your public health and your public safety, in living a more affordable life and dealing with housing needs. Not just here's a document, but what does that document mean to you if you're watching this or someone circulated this video to you to be able to see it. So we're going to discuss that. We're going to discuss the way we've been able to balance the budget. And we're going to touch on some of the additional programs that we're announcing, as well as those that we've had in place that we're going to maintain in place. All of that we'll deal with tomorrow. And from a process standpoint, as we turn the budget over to the County Board of Legislators, they will continue their review. They've already started on the capital budget, which we released in the middle of October. Now they'll have the operating budget and the special district budgets, refuse districts, sewer districts, and so forth, for their review. They have set a date sometime in mid-December where they intend to come to final closure on the budget. And what we have in mind, of course, is to have a budget in place when the new year starts on January 1st. Our new calendar year is also our new budget year. And hopefully we'll be in place with all of our budgets and continue to manage our budgets wisely and properly. We are still looking at the fall 2021 Hudson Valley Restaurant Week, which is a great promotional effort here in Westchester County, and I'd like Ken to just sort of cover that with you as a reminder of a great program that's out there that we participate in.
Thanks, George, and especially given the fact that in Westchester County, only New York City is required to have vaccinations to go to those restaurants. It's an opportunity here for fall 2021 for the Hudson Valley Restaurant Week. Those festivities are going to continue. There's an extensive list of the participating restaurants now at valleytable.com/HVRW. And of course, it's going to be on the screen to do that. There's some new eateries, some familiar favorites. Certainly our friends right across the street at Molino's. More than 60 Westchester restaurants are participating in this annual celebration of the local culinary scene. There are reservations that are required because the seats fill up extremely quickly. It goes from now until the 14th of November. The tremendous chefs that we have throughout the Hudson Valley are going to be celebrating that restaurant week with delicious, creative dishes featuring locally sourced ingredients. During the 2-week period, there's a price-fixed menu, $25.95 for lunch, and dinner's at $35.95, so it's certainly a good opportunity to get out there and participate. And certainly we have some new restaurants, Labatt here in White Plains, Tramonto, Harvest on the Hudson, and Rosie's Bistro, which was hit so hard by the recent floods, is also participating, and we love going to Rosie's as well. Thanks, George.
Thanks, Ken. And just to close out the formal part of the report, we just want to remind you that this Thursday is Veterans Day. It's a day set aside to honor all the men and women of our nation that have put on the uniform of our country, whether in wartime or peacetime, to serve us. And there are going to be a wide number of ceremonies. The day was picked, as I think we all know, to coincide, built off of Armistice Day from World War I, which was the 11th day of the 11th month. And of course, the armistice was signed at the 11th hour in ending American involvement and everyone's involvement in the First World War. At the time was known as the Great War, but within the space of 20 years, the world was once again at war, and now we know this is the Second and the First World Wars. At that time, we're going to honor veterans in all of our different hometowns all across the county. Some services will be preceded by parades. Some will start at 10:30 and end at 11 o'clock, which is the appointed hour. Some will begin at 11 o'clock and go on. There's some that are going to go on in the afternoon. Hartsdale, Greenberg has one at 2 o'clock in the afternoon. American Legion Post in Larchmont has one at 3 o'clock. It is going to spread it over the course of the day. The day before that, on Wednesday, November 10th, the county will celebrate Veterans Day at Lasted, where we have our honoring our veterans. That's where we have our permanent site to honor veterans, and that begins at 1:30. And Ron Tochi, who heads our Veteran Services Agency, will be the MC for that program. It will be streamed live on Facebook. If you want to see it that way, you can certainly welcome to come in attendance at the Lasden Park Arboretum, the Veterans Memorial. It's on Route 35. It's in Katona in terms of zip code name. It's actually within the town of Somers, and it's easily accessible from the Taconic Parkway to the west and from I-684 to the east. We welcome you to join us on Wednesday, November 10th at Lasden at 1:30. And then again, look in your local town, village, and city information to find out what services are in your backyard. And if you have the discretionary time, I would encourage you to please go. Spend 1 hour recognizing our veterans. They spent many, many hours sacrificing their time and energy and effort, putting themselves in harm's way. Those that did not make it made the ultimate sacrifice, and those that came back with illnesses or with loss of limbs, with a diminished physical life, all those sacrifices made for us as Americans to protect our safety and our freedom, we owe them at the very least a day of gratitude that comes up every year, Veterans Day, on November 11th. With that, we'll go to any questions that we may have. Catherine Chaffee, our Director of Communication, is with us. Do we have any press questions today?
We do. We have one from David Proper from the Journal News. He asks, what do you think of Congressman Jamal Bowman's voting against the infrastructure bill?
Well, for those who, I assume everybody follows these things, but in case you did not, the House of Representatives recently voted to pass the physical infrastructure bill that had previously passed the United States Senate. I support the passage of that bill. We think it's very valuable. We don't know how much of that allocation will come to help Westchester County with our infrastructure projects. As you've seen us discuss here, we put a lot of emphasis on fixing things that are broken, whether they're broken roads, broken bridges, sewer treatment systems, underground pipes, above-ground parks, and other facilities. And as much money as the county government can put into those efforts, the assistance of the federal government is essential. So we support that. Congressman Bowman is a friend, and friends disagree sometimes on issues. More importantly, I've served in 4 different legislative bodies, and from time to time an issue arises, and you vote one way and somebody votes a different way. We move forward together, and in this particular case, the bill passed. It will be signed by the president into law, and we look forward for that to happening. Now, there's still a debate about the social infrastructure bill in Washington, and that would provide additional funds. And I can certainly tell you, any funds that we get from the state government or the federal government, we put to good use in Westchester County. We use them responsibly. We use them for the purposes that they were intended, and we make sure that every dollar is trackable so that we're responsible for that. Keep in mind that Westchester County is a generator of wealth to the United States government. We send more tax dollars from Westchester residents and federal taxes to the federal government than the federal government returns to Westchester. And that's true for the state of New York. There are some areas, Alaska, Kentucky, where the federal support for those states in a host of different ways exceeds the amount of taxes that those localities generate. But we are a tax donator, and so whenever resources do come from the federal government that can help us with the needs that we have here in this county and this state, then I support it. And I'm happy that the bill passed. And we'll have plenty of time to talk about all these different issues at the national level, at the state level. We are running the county government. We're trying to do the best we can right here, and hopefully that we'll move forward on it. Any other questions? Okay. If there's anyone else from the press that's interested in reaching out to us, you can call Catherine Chaffee, 995-2932. She'll be happy to make a connection for us, and we'll be happy to answer those things. Any issues that relate to our program in dealing with COVID, Dr. Charlita Amler, you can call us, and we'll connect you to Dr. Amler. She's a great interview. She's been doing this quite a number of times here. I don't know if she took a course in med school about how to communicate to the public, but she has certainly passed that test over the course of the last year and a half, and I thank her for her leadership and her advice throughout this process. I'm George Latimer, Westchester County Executive. Thanks for tuning in. We'll be back tomorrow to review the county budget with you in some detail, and that will be under discussion for the month that follows. Thank you very much for your time. Thank you to the young folks who are here to speak, and thank you to their parents for allowing that to happen, and we'll see you all soon. Have a good day.